Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. I have been a cardiologist for more than 40 years here in the Houston area, and this is a series of lectures on your heart. The focus of this presentation is: can I increase or raise my HDL, the good cholesterol? What do I need to increase my HDL level? Let us look into the main feature presentation. Before we proceed any further, I would like to give you a cholesterol 101 lesson. The total cholesterol should be between 160 to 200 milligram percent. The LDL, the bad cholesterol, should be less than 100 milligram percent. And if you have history of diabetes or heart disease, they expect you to have a level below 70 milligram percent. The good cholesterol, which is the high density lipoprotein, is supposed to be greater than 40 milligram percent. Anything less than 40 milligram percent is associated with higher incidence of coronary artery disease and its complications. Triglycerides should be less than 150 milligram percent. More recent studies show that the triglycerides act as an independent risk factor for development of heart disease if the triglycerides are greater than 150 or 200 milligram percent. There's one more element which we'll just touch upon, that is the ApoA lipoprotein, which is associated with HDL, and it increases the HDL level, and also it decreases the plaque building in the arteries. If the ApoA is higher, then it will help in the regression of the plaque buildup, which we will study in a minute. Keeping that in mind, let's look at what is the role of HDL, the good cholesterol. Why is it called the good cholesterol? And as you know, there is a plaque buildup in the arteries supplying the heart muscle, or in the neck arteries, or in the leg arteries over a period of 2 to 3 decades. It starts off as a small fatty streak, and then we have the deposition of LDL, the bad boy, the cholesterol, and then there is proliferation of the muscle cells and white cells, and all these calcium build up as a mount inside the artery, narrowing the lumen of the artery. The role of the HDL is to come inside these plaques and remove this LDL cholesterol and return it to the liver to be metabolized. The higher the HDL, the lower the risk of developing these significant atherosclerotic plaques. So keeping this in mind, let us look at how the LDL level reflects in the real world as to the incidence of heart disease. And in the red is the HDL level represented here, and on the other side we have the total cholesterol level represented here. On the left hand side we have the 14-year incidence, the percentage rate of heart disease. So let's start off. If you have less than 40 milligram percent cholesterol, if your cholesterol, even if it is less than 200, your risk of developing heart disease over 14 years is almost 12%. Whereas if you have a HDL level of greater than 60, your risk of developing heart disease is around like 3, is almost a 4 to 5-fold decrease in the incidence of heart disease if you can get your HDL level up. That is easier said than done. But anyway, so even at higher levels of total cholesterol measurement, if your HDL is greater than 60, your chances of getting heart disease are considerably lesser compared to if your cholesterol level was 200 and the HDL level was less than 40. So you get the picture. So it is the total cholesterol which is important, and it is the HDL which is more important in reducing the incidence of heart disease in patients. What does HDL do besides remove the cholesterol from the plaques? It also acts as an antioxidant, which prevents the oxidation of LDL into intermediate density lipoprotein and very low density lipoprotein. And it is this one that is this bad boy which is deposited in the plaques. So it blocks the conversion of LDL into very low density lipoprotein. The HDL also acts as an anti-inflammatory agent, reducing the inflammation in the plaque and removing some of these blood white cells from the plaque. It also acts as an immunomodulator, that is, it preserves the integrity of the endothelial lining. It also helps in the endothelial cell repair. Besides that, it acts as an antithrombotic agent. As you know, these platelets stick together to form little clots that may be trapped in these plaques, and it prevents these platelets from sticking. As a result, there's less amount of platelet aggregates seen in the plaque development. HDL is not just one entity. HDL has different types. There's HDL2 and HDL3. They vary depending upon their size, their density, how many molecules are there in that little capsule, and also the charge and chemical composition and functionality. The high levels of HDL3C cholesterol you have, it means lower the risk of having heart disease. Here is a breakdown of HDL2, which is like a large particle size, which is much more atherosclerotic compared to HDL3C, which is small, dense particle, which reduces the risk of plaque building in the arteries. All of you must have heard that if you drink alcohol, it increases your HDL, and that's a great way to increase your HDL. I would say, hold it. That is not accurate. As you can see, if you look at the density of the HDL, the normal cholesterol is having a higher percentage of more densely packed HDL, whereas with alcohol, you get an HDL which is large and fluffy, which is less dense. So it is not the best kind of HDL you expect to raise with alcohol. Besides, if you look at here, 210 grams, that's almost close to 8 ounces of drink per week. That's a lot of alcohol. I mean, if you're taking so much alcohol, you have to think about the other side effects of alcohol, like liver problems, cirrhosis, then alcohol-related GI problems, alcohol-related addiction. And to add all these things, the price that you pay drinking 8 ounces of liquor per week far more exceeds the benefit that you're going to get. And if younger people do this, they have a likely chance of developing heart failure, that is alcoholic cardiomyopathy. So there are a lot of risks. So I would not recommend alcohol as the source for raising your HDL level. Now, the relationship between alcohol and reduction in heart disease is sort of marginal. I mean, as I said, if you are drinking 3 ounces, which is 90 ml, 90 grams, you reduce the risk of heart disease. You reduce the relative risk by about 20%. That's not a big benefit if you're drinking 3 ounces of alcohol every day. So keep that in mind. Now let's move on to what are the things that can naturally increase your HDL level. Keeping ideal body weight will help you to increase your HDL level. Eating healthy foods and reducing a lot of cholesterol intake and fat intake will reduce your total cholesterol, it will reduce your LDL level, and that will help to improve your HDL LDL ratio. All right. If you drink, I would say maybe one drink, not even every day, maybe all right. But using alcohol to raise your HDL level is like asking for trouble, because the other side effects of alcohol far exceed the benefit you're going to get from the reduction in the heart disease. Smoking reduces HDL level. So if you can cut down smoking, get your healthy eating habits in order, and reduce your weight, you'll be doing a lot more better by increasing your HDL level. And of course, sleep and stress reduction may also add to improve your HDL level. There are certain medications that can increase your HDL level, the most significant of which is the statins. They can increase the HDL level while at the same time decreasing the bad cholesterol, that is the LDL level, by almost 40-50%. The HDL level may go up by like 10-15%. Not a whole lot, but it's better than nothing. Same thing with the fenofibrates. They are like Trico, something like that, will reduce the triglyceride levels and also increase the HDL level. Niacin is known to increase your HDL level. Some people may have trouble taking niacin because of flushing, that is a sustained release or controlled release niacin that may not give you so much symptoms. You may try that one. Exercise is a good way to naturally increase APO1 protein level and also HDL level. By exercise, you can increase the HDL level by at least 10 to 12%. So keep that in mind. I already talked about alcohol. I don't want to rub too much alcohol issue on this topic. And let's spend a couple of minutes on elevated ApoA1. This is a protein which is associated with HDL. This protein decreases the development of atherosclerosis in animals. It has been shown to decrease the development of atherosclerosis. It has also been shown to reduce the plaque that is already built in patients with coronary artery disease. Some of the things that can increase the APO1A include alcohol, exercise, and lean body mass. Out of three, I would recommend regular exercise and maintaining your body weight, which will go a long way in helping you to not only increase the HDL level, increase the APO1 level, but also decrease the LDL level, which is equally important. So ladies and gentlemen, in conclusion, these are some of the simple steps you can do, keeping your body weight under control, reducing your calorie and fat intake, getting on a regular exercise program, and cutting smoking. Thank you so much for watching this presentation on HDL and heart disease and the role of good cholesterol, that is HDL, in reducing the atherosclerotic plaques. I will see you in the next video. We have numerous videos on heart education on our YouTube channel. Please do watch them and please do subscribe to our channel. I will see you in the next video.